Hello everyone. Hi. How is everybody doing? Welcome to our Thyroid Thursdays, our live sessions where I can interact live with you, answer your questions, share something unique or new that I have learned during my journey, and more importantly kind of create this community where I get to know more of my people that I'm trying to serve over here and see how I can help you guys. So that's what this live sessions are for. So I would like to know more about you. So please use the chat section. Why don't we start with some introductions? So if you can share with me, your name and where you're from. That is always useful because that kind of keeps me connected with you guys. We are living in a virtual world, and obviously we are people who are joining us from all over the world. So it is nice to know where you're joining us from, and then what are your issues you're dealing with. And then obviously I'm going to take questions and I'm going to answer those. And what we're trying to do with these new live sessions is that actually, because there are so many questions and people were actually emailing me later on, is that I never got my question answered, or I never got a chance to kind of tell you about more about me. So this time what we have created with the new things about the live session is that we are sharing a form beforehand, so that way you can submit your questions over there, and I will go over all those questions and then see if I am able to answer those. So that way, like, it is an opportunity for you to share your information with me, and if and that way there is a higher chance that I will be able to respond to your questions directly. So today I'm going to respond to those questions, people who have already submitted their query through by filling up that form, and then I'm going to take up questions of people who are putting up questions over here. But as I said, it is very difficult to answer all the questions in the chat section because it gets too busy. We'll be keep doing these live sessions in the future also, and please remember that we will be posting a form, a Google form that you can fill up, and that with your details, including your question, and we will giving the priority to those people who are filling up that form, so that I can answer that for you. Okay. So yes, look out for next in the community sections. Whenever there's a live session information which is posted, the form will be posted. I will see if we can post the link to the form here again, so at least you can start filling it up, and then we might not be able to get it the form today, but we will try to look at it next time. So see in the chat section, we might be able to post the link in the chat section about that form also. So, but yes, let's see where people are joining us from. So, Janessa has joining us from UK. Welcome over here. And then somebody joining us from West Bengal. Priyanka is joining us from New Delhi, India. And then Aarti joining us from Hyderabad. And Karen is joining us from Guyana. Welcome over here, everybody. Melanie is joining us from US. So that's great. So yes, please share where you are joining us from in the chat section. Um, Sanjay is joining us from Lucknow. This is great. So wonderful. So that's great that we are seeing so many people. Kamal Kant is joining us from India. So Terry is joining us from California. Shantanu joining us from Bhubaneswar, India. So wonderful, great. Yeah, this live session, it was just a last minute thing. That I just wanted to share some information with you, and also trying to had some time on my hand today, so I thought let's just go on a live session and share the information with you. But hopefully we'll be getting more organized with doing these live sessions at least maybe a couple of times a month. So that way we can keep coming, and I can keep coming with new information. And the future actually is what I'm looking at is doing a big masterclass on inflammation, because what I realized was that a lot of people have inflammation issues, and obviously I've shared tons of videos on inflammation, but I wanted to give like everything in one masterclass, so that exactly like what to follow and things. So that is coming up in the future. We've already done a masterclass on thyroid, so if you have thyroid issues, please watch that masterclass. That will definitely be good use for you, because that's where I share my 3-step process of fixing the thyroid problems. Okay. So good. So more people have joined in. I think I'm going to start answering some questions so that we can try to get as many questions as possible. All right. So let me open up my sheet. So first question which was submitted was from Lisa from Texas, US. Her question was that, aside from the thyroid panel, what top three tests we should be getting to get to the root cause of the Hashimoto's? Okay. So testing for thyroid, again, a very important topic. So yes, like a lot of people are aware of it, but I want to go over the testing again, so each and every person knows exactly what they should be testing for. Okay. And this might be a good time for you to write these things down, because these can be too confusing. So first test which everybody is getting, which everybody should get, is a TSH, thyroid stimulating hormone test, right? TSH test everybody should be getting. Beyond that, you get your thyroid hormone levels checked, which is T4 and T3. Now, most of the people will get total T4 and total T3. I prefer to get free T4 and free T3. Okay. So, what is the difference? First of all, what is total and what is free? So, whenever your thyroid gland produces thyroid hormone, which is the T4, it is bound to a molecule, okay, which is a thyroid binding globulin, which is it is bound to, and this circulates in your whole blood. Okay, but when your body cells have to utilize this T4 and T3, it has to be removed from this binding globulin in the free form. Okay, so this free form is actually which your cells can utilize. So that's the reason it's very important to utilize or check the free form. So free T4 and free T3 is a test that you should be getting. So TSH, free T3, free T4. Along with that, you get two Hashimoto's antibodies checked too, okay, which is a TPO, thyroid peroxidase antibodies, and the other one is excuse me, thyroglobulin antibodies. Okay, very important to get both of these antibodies checked, not one, not two, but both of them. Okay, if any of these antibodies are high, that tells us that you have Hashimoto's disease. And then once you have these antibodies high, then you have to follow them so that you can know whether they're increasing or decreasing. And as you know, I'm a big believer that we want to reduce these antibodies as we go along, right? Not we don't want to if you go to your regular doctors or conventional doctors and ask them, well, what can you do about antibodies? They will always say that nothing can be done. Your antibodies are always going to be high. Once your thyroid is destroyed, then your antibodies are going to go away. But till the time, it is going to be there. Absolutely wrong thing. When clients work with us, patients work with us, their antibodies go down. Okay, so you can bring the antibodies down. So please, that's the reason it's very important to follow these antibodies, because if you're not following the thyroid antibodies, then you will not know whether your thyroid is getting better or not. Because TSH is not a good test to follow through, because TSH changes very rapidly. This was an experiment I did on myself, like a couple of years ago when I was starting my functional medicine journey. I tested my TSH uh, in 3 different days in a week, and my TSH was different. One day it was 2.6, the other way I think it was little bit variation of 2.8, the other time it was 1.9. So yes, the TSH was varying for me, like during this time. And I see this very often. A lot of people, the TSH quickly changes for them. So that's the reason TSH is not a good molecule to check. It changes very rapidly. T3 and T4 are much more stable molecules to check. So check your T3, T4 levels, and also check your antibodies so that you will know exactly whether your thyroid antibodies is getting better and your thyroid is getting better. Now again, I want to share this story. It's whenever my patients get better, I get always very excited about them getting better. So this particular patient of mine, 39-year-old female, working with me for 4 months now, initially when she came to see us, her antibodies were in TPO antibodies were in 700 ranges, and the thyroglobulin was in around 80, so just slightly elevated, but TPO was 700. After 4 months, of working with us, we worked on our gut inflammation, we worked on detoxification. She had high mold levels and things. And then we worked on mitochondrial health. And finally, from 700, like the repeat blood work showed, her antibodies in 4 months itself are already down to 140s. Okay, so from 700, in 140s, still she's not in normal ranges, but I'm very happy with the results. Obviously she has more energy, she's feeling much better in terms of weight wise. She has lost like around 12 pounds, a lot of energy. Gut is much better, brain fog is gone, so all that is there. But majorly this is telling us that her thyroid is much better, and hopefully in the next few more months that her antibodies will back to be normal. So very important, first of all, don't let anybody tell you that you cannot reduce those antibodies. You can. All of our patients are able to reduce their antibodies. You can too. Follow the right steps. Okay. So test TPO antibodies, thyroid globulin antibodies, T3, T4, TSH. And then beyond that, what else needs to be checked? Okay. So you need to check your inflammation markers, HSCRP in your blood. Okay. Because if you do have too much inflammation, then again, that is not good. You need to work on reducing that inflammation. The second thing to test is to check for gut biomarkers. Okay, especially, do you have parasites in your gut, do you have bad bacteria in your gut? If you have access to those advanced testing, get that checked. Then you check your vitamin levels. Vitamin D is very important to check, so that we know if you're low in vitamin D, you need to know about it, replace it. Vitamin B12, and homocysteine levels. Homocysteine levels are very important because that tells us inflammation in your body as well as in your cardiovascular tree, but it also can point towards something called MTHFR mutation. What is MTHFR mutation? I think somebody asked this question, when they submitted the form. Let me see over here. Where did that go? Homocysteine. Yes, Priyanka from India actually asked this question. Please elaborate on homocysteine. My homocysteine levels are elevated. How do I fix it? Okay. So that's where why homocysteine levels are elevated. There can be a couple of reasons. First of all, it is because of deficiency of vitamin B12. Okay. Second of all, it can also be because genetic component is there where you do have MTHFR genetic mutation. MTHFR is a gene which helps your B vitamins to get converted into methylated version of these B vitamins. Okay. And this is one of the most common mutations that people have, is that one of the gene is not working, and so every gene has two copies into your body. Okay, and we need both the copies working to be perfect. But in MTHFR issue, around, it has been estimated that between 40 to 60% of population can have MTHFR issue with one gene not working. So those people are not converting their B vitamins properly, and that can lead to homocysteine being elevated. So then what you need to do, you need to support your MTHFR gene by taking high doses of methyl folate, particularly because that's what feeds it. And then also, it's always nice to supplement with methyl B12 along with that, because both of these things together will support your homocysteine genes. Okay, can you fix it with diet alone? Very difficult, because unfortunately we do not have good methylated sources of food. That is something that happens inside your body. So unfortunately, this is a genetic problem, that where you have to take those high doses of methyl folate and then methyl B12 to reduce your homocysteine. Plus, working on inflammation levels in your body is also very important, which again, you can use turmeric as a good anti-inflammatory source. You can use good quality omega 3s as a good source of inflammation reducing in your body, and those things will help with homocysteine. Okay, but homocysteine is telling you inflammation is present in the body, especially in your cardiovascular tree, so very important to bring it down. And plus, it also tells us that your methylation of your B vitamins is not working properly, so definitely recommended supplementation will be important. Okay, and as you know, we have created high quality supplements, so if you're looking to buy those, we'll put links in the description where you can just go and then buy those. These anti-inflammatory supplements and methylated supplements, so you can look into that. Okay, so coming back to the testing piece of it: TSH, T3, T4, TPO antibodies, thyroglobulin antibodies, HSCRP for inflammation, homocysteine to also look for inflammation, as well as your B vitamins. Vitamin D, your level should be more than 40, not less than that. And then plus, if you have access to a gut test, that will also be really good to do, because a gut test will also tell you about the gut health, especially your gut microbiome. Then somebody else has question. Zayed has question from India. Dairy is not allowed in Hashimoto's. You're absolutely correct that dairy is very inflammatory for Hashimoto's people. So I recommend staying away from dairy. But how about staying away from butter or yogurt or Indian ghee? Okay. So these three foods are very common question that I get. So first of all, butter and yogurt are dairy. So yes, you need to stay away from them also. But Indian ghee you can use, because the way the Indian ghee is processed, it, like the most of the dairy is removed from it. So that's the reason Indian ghee is, obviously get good quality organic A2 Indian ghee. But if you get those, then yes, that is fine to use. But butter and yogurt, you need to stay away from it. You can do dairy free yogurt, that is perfectly fine. Okay. So yes, dairy is a very big problem. Almost all of my patients initially do not realize, but once they eliminate dairy, they feel significant improvement in their gut bloating. Dairy, or once they eliminate dairy, that will help improve their mood. They will help improve their inflammation levels in the body, as well as energy levels. All of these things will get better once you eliminate dairy. So definitely I will recommend staying away from dairy. All right. So then we have somebody from Chattanooga, Tennessee, Francis. TPO levels are 36, and I'm told that I need to drive it down further. So, absolutely, that is the case. The more TPO levels, TPO is thyroid peroxidase antibodies, right? And 36 is just barely high, but it is high. So, if you can bring them down, that is better. What can you do to lower TPO antibodies, right? That's a bigger question. Well, obviously, diet plays a very significant role, which I think you said you're already following. What else can be done? This is where supplementation can be useful. So, one is selenium. We have seen that, we have research studies that shows that 100 micrograms or 200 micrograms of selenium is needed. That will help to lower antibodies. So that's one supplement. Zinc is the second one. 30 milligrams of the dosage typically is what people will take, which will again help to lower their antibodies. The third one will be L-tyrosine, which is an amino acid which is required by your thyroid gland to function properly, which can help to lower antibodies. Iodine, either you take it through food or either through supplementation, will be helpful to reducing antibodies. Magnesium will be another one which will help in reducing antibodies. And then omega 3 supplementation, okay, is very important. And high dose omega 3s, that is again a very important thing. Most people will be taking omega 3s and they don't look at the label or the ingredients, and it says 1000 milligrams of omega 3s. Well, we are looking at for only EPA and DHA, okay. So when you are buying your omega 3 supplements, look at the bottle and and calculate the amount of EPA and DHA. And if it is more than 1000, then only buy that particular supplement. Otherwise, don't, because it is useless. Again, I have created a special thyroid supplement which has all of these things into it, like zinc, selenium, L-tyrosine, iodine, all the other things needed. Link will be in the description, in the chat box, if you guys are interested in buying it. And same with omega 3s. So that's what you can do in lowering the antibodies. Those are the basic things that works for a lot of my clients. And then beyond that, if it is still not working, that's where the root cause approach is what you need to look into. What are root causes? Those are the reasons why did you get thyroid disorders, right, in the first place. So that's where, you start looking at your root causes, whether something is going on in your gut, whether you have too many toxins in your system like heavy metals, lead, mercury, arsenic, whether you have mold toxins or environmental toxins. So these are all the reasons of root causes, or reactivation of Epstein-Barr virus. Very, very important reason which causes Hashimoto's disease or doesn't let the antibodies to go down. Okay. So that's what I tell people, like, on the long term basis, if you're interested in uh, getting your thyroid functioning better, lowering your antibodies, then start looking for those root causes. And trust me, like, when people start working with me, oh, my diet is perfect, oh well, I don't have any stress in my life, oh well, there is no way that I'll be low in vitamins and minerals, there is no way that I'll have bad bacteria in my gut, I feel like, I'm so clean, I'm so good, like everything is perfect in my life. And when we do those advanced testing and the results come back, oh my god, people will just flip out. They'll say, wow, I had no idea there was so much stuff which was going on inside my body. They had so much bad bacteria. Their balance between the good and the bad bacteria is off. Sometimes, Like, they will have toxins which they have never idea about how they got exposed to it. Or, their hormonal levels will be out of whack. Or, they will have one particular vitamin, which they have never thought about, which will be low in them. So that's where these advanced testing is so beautiful, that it tells exactly the reason why a person is feeling the way they are, and tells you how to get better. So yes, but it is difficult to get advanced testing. I totally agree with that. It is expensive, not for everyone. And hopefully, like in the future, when the insurance starts picking up the tab and pay for these advanced testing, they'll be cheaper. But right now they are not. But if you have the ability, do them. So that's what you can do to lower your antibodies, Francis. So that's great. Now let's see what other inflammation we question we have. Sanjay from Mumbai has this question about gut inflammation, how to treat well, and how is it connected to thyroid. Well, everything starts in the gut. If you have not heard that, then you are hearing it today. Okay, so it's about leaky gut. All right. So we have this gut lining, which is all plastered together. And then what happens in leaky gut is that this lining between the junction, the plastering between those gut cells is gone. So everything that you enter from your gut goes to your bloodstream and starts doing this leaky gut. Okay. And this leaky gut starts the inflammation process in your body, in your gut, and then ultimately, causes Hashimoto's disease. So that's the reason gut health is so important whenever there is overgrowth of bad bacteria. So we have trillions of bacteria that lives in the gut. Okay. Some good, some bad. And everybody, like who has Hashimoto's disease, trust me, like everybody will have an imbalance between their good and the bad. Okay. So then you have to work on the gut health, and unfortunately a lot of times you don't even have symptoms. Some people will say, well, I never had any idea that my gut was out of whack. I have regular bowel movements, they are in perfect shape, size, I don't have gas and bloating. How can I have an imbalance between my good and bad bacteria? I said, exactly, that's what happens, that sometimes the symptoms are not there. So gut inflammation is very important. How to fix it? You start eating good, right? Remove all the processed food that definitely damages your gut lining. So any fast food you're eating, any processed food, fried food you're eating, definitely goes away. Get rid of dairy and gluten, very big destroyer of the gut, and start eating gut healing foods, prebiotic rich foods. Okay. So those prebiotic rich foods are foods that are high in fiber, like your nuts and seeds. Soaked chia seeds, are good for that. Your apples are good, onions are great, garlic is good. Artichokes, are high in prebiotic fibers. So include all of these things. Probiotic rich foods, like your dairy free yogurts are good. Kimchi, sauerkrauts, fermented vegetables, those are again great probiotic foods that you can eat. Okay. Antioxidant foods, food which has color into it. Okay, not artificial colors, but colorful eats. I call it rainbow colored diet. So try to do a rainbow colored diet, very very useful for you. Okay. So the more color you have, if you look at today's meals, okay, and from breakfast, lunch, and dinner, if you can count at least 8 or more colors that you ate today, then you did a good job. Okay. The target is 10, which is very difficult, but at least 8 colors if you have eaten in your day's meals, that means you did a good job of providing your gut with the right nutrients. Okay. So that's what everybody should be working on, of providing these antioxidants by eating colorful foods of different varieties. Okay. Supplements, yes, L-glutamine is a great supplement that fixes the gut. Probiotics are great supplements. Again, good quality probiotics, minimum of 20 to 30 billion units, and a combination of bifidobacterium, lactobacillus, and saccharomyces and bacillus. Okay, is what you're looking at in terms of providing you the good probiotics. So look for that probiotic which provides you the right strains. I think somebody has this question also in posted before in the form, that I'm using high dose probiotics, okay, which is 30 billion or more. Is there any possible side effects? So there is no side effect of typically of the high dose probiotics, okay, but will or is are they supposed to be used indefinitely, those probiotics, for years and years? No. What I recommend is that do an intense protocol of 4 to 6 months of using these probiotics daily, but then after that, take breaks in between. Okay. So that again, you do not feed too much the bad bacteria also. Okay. Because sometimes what happens is that if you're taking too many high doses of probiotics, some of these might support the growth of the other bad bacteria too. Okay. So probiotics are good, no question about it. 4 to 6 months is great. After that, do rotational basis. Finish up one box of probiotic, take a break for 1 or 2 months, then do another box, and then take a break and do another one. Okay. So that your body is getting probiotics. So that's good. Okay. So as I said, L-glutamine is great. Probiotics are great that you can use. Again, anti-inflammatory supplements. This is where our Inflamma Pro supplement is amazing for gut inflammation, because it has curcumin into it, it has ginger into it, it has boswellia into it, it has quercetin into it. All of these four works great for gut inflammation, and we have like tons of research studies on that. Okay. So include them either as a food form or either as a supplement form. The Inflamma Pro supplement, as I said, which is available both now in India as well as across the world. So use that. Okay. So that's where these are good to include. That's what helps with your leaky gut, that's helps with the gut inflammation. Okay. So that's the gut protocol that you can follow to fix your gut problem. Okay, great. Let me kind of see if any other things are left behind in terms of the other questions that people have asked. I think I covered majority of them. um, Somebody has question about like type 2 diabetes. So yes, type 2 diabetes can be reversed. The whole protocol is really big, very difficult to share it on an online platform like this. But yes, several of our patients who have worked with us are able to reverse their diabetes. Along with diet and exercise, yes, supplements needs to be used to reverse diabetes. Alone, diet and exercise is very difficult to reverse diabetes. So that's the case. Okay, so those were the questions that people ask over there. Um, I'm looking at the questions over here regarding the gut. How can we get rid of the bad gut bacteria? So bad bacteria, first of all, which what kind of bad bacteria do we have? Okay. Um, so that is very important to know whether you have Clostridium species, whether you have Streptococcus species, whether you have Staphylococcus species, right? So different kinds of bad bacteria, right? So that's the case. So that's where that advanced stool test is really good to tell us exactly what kind of bad bacteria is present. But let's say you are not able to do that advanced stool test, then what can you do? Again, the diet I told is good. There are certain supplements which can rebalance the gut microbiome by kind of getting rid of the bad bacteria. Oil of oregano supplement is good in that way, which helps to get rid of the bad bacteria. Berberine is a good supplement, which again helps to get rid of the bad bacteria. And plus, if you have weight issues that you're not able to lose weight, or you have diabetes and things, berberine can be really good, because again it helps in metabolic functioning of your gut and can help to improve weight loss issues also. So that's where oil of oregano is good, berberine is good. And then garlic is really good. Garlic has a compound called allicin, which again helps in removing the bad bacteria and parasites from the gut. So that is third thing that you can include to help to get rid of the bad bacteria. And then again, probiotics are good. That will make sure then when the bad bacteria is gone, that your good bacteria stays in your gut. Okay. So that's good. Let's see what other questions we have. So Akshay has this question: does palpitations and anxiety have any correlation with thyroid? So yes, that is the case. Very very common. So palpitation and anxiety are one of the most common side effect of thyroid medication. Okay, a lot of people are not even aware of it. That the thyroid medication can give those side effects of having palpitations, anxiety, and stomach bloating or bloating in general. Okay, because a lot of thyroid medications have fillers in them, like lactose, or they have like gluten in them. And plus, the real problem is actually not their thyroid is not functioning. It's actually the underlying inflammation causing the problem. And when people are fed too many of this thyroid, high dose of these thyroid medications, that leads to these symptoms. So again, this story is about a 17-year-old kid who was working with me. She came to see me around a year ago. She was diagnosed with thyroid disorders. Before that, she was feeling tired and fatigued, and she was not able to perform really good in the school. She was diagnosed with Hashimoto's, was put on medication. As soon as she was put on medications, she became really anxious. She started having palpitations, and her symptoms got even worse of energy and things. She went to the doctor. She said, everything is fine. Medicine cannot do that for you. Your numbers look good. And she said, no, this is not making sense. Like the medicine is not helping, making things worse. So she kept on telling them, but they did not listen. That's where her mom and her wanted to work with me. So they came to see me. And she had already stopped the medication by the time. Her numbers, her T3, T4 were normal, but TSH was slightly elevated. The TSH was, I think, in the ranges of 6 point something. I don't remember the exact number, but 6 point something. So then we started working on a protocol for her. Okay. And then even without the medication, we were able to improve her anxiety, her palpitations issues, her energy came back, her brain was functioning better. She was able to concentrate on things, and she was fully functional in her school. And her TSH also actually improved significantly, and it came back within the normal ranges. So again, it took her few months to work on the root cause, work on all the things. And unfortunately, medicine, in her case, medicine was actually making things worse for her, by causing her symptoms. So that was an unfortunate piece. And then luckily, she was able to work on a root cause approach, and things got better. So yes, one of the common side effects of thyronorm or levothyroxine is that it can have palpitation, stress, anxiety, bloating as a side effect. Now, again, I'm not telling you or out everybody out here listening saying that, okay, you can stop your medications, or today is the day to stop your medications. Absolutely not. Some people need the medications. Okay. So it all depends on person to person. But my job is to give you information that might be applicable to some person. So make sure you're working with a doctor, especially functional medicine provider, so that these things can be handled safely, because stopping the medicines can definitely have this own side effects and problems. Okay. So yes, and as you guys are aware, we offer consultations to people worldwide over. So if you're interested in working with me, you can always look at the options. Unfortunately, again, we have limited slots, so we only work with certain clients, and sometimes we have to close down those slots just because we are getting too many inquiries right now. But yes, you can definitely try to reach us out, and we can see if we can work with you or not. Okay, wonderful. Then somebody has this question: does LDN help manage Hashimoto's? My TPO antibodies are within normal range. My thyroid hormones is normal, but my TGAB, which is my thyroglobulin antibody, is high. Okay. Now, LDN, what is LDN? Low dose naltrexone is an LDN. Naltrexone is a medicine which was used for people with, giving up addictions. Okay. Low dose naltrexone was shown some time ago as a promising modality of treatment for autoimmune conditions. And there was a very small research study done which showed that it improved Hashimoto's antibodies, especially TPO antibodies. Okay. Now I use LDN a lot initially in my clients. Okay. And whether it was the LDN or the other things which were working or not, we don't know, but we saw some improvement. But since the time, I have actually, what I have looked at is that LDN works for only 20 to 30% of people. Beyond that, for 80% of people, LDN doesn't do anything. Okay. Now, first of all, is it safe? It is safe because it is low dose. We don't typically have side effects, but it has to be compounded. So availability of LDN becomes difficult in that way. Okay, it is not regular pharmacies will have a lot of fillers. It doesn't work. So you have to use only compounded LDN with specialized pharmacy. So that's one problem over there. The second issue is that I have not seen that LDN can have significant impact in reducing antibodies what others can't do. Others means like other supplements and other things that we are able to use and do things, they work equally good, and we have seen great results with those. So that's the reason I don't use LDN in my protocols anymore, because it was not a big game changer. And but Yes, it doesn't have much side effects. So somebody wants to try it, you can. But like, is it going to be really game changer, especially for thyroglobulin antibodies? I doubt that is the case. So, so that's one about the LDN and things. Thyroid nodules. Well, thyroid nodules are again always a question how we can reduce them, right? Thyroid nodules are very common situation. Anybody who has Hashimoto's, most likely around 70% of people who have Hashimoto's disease will have thyroid nodules. Are all thyroid nodules dangerous? No, but obviously you should get them checked to make sure that they are not cancerous or anything. But most of the thyroid nodules are benign. It is because of inflammation in the thyroid gland that those thyroid nodules are present. Okay. So do we have a couple of research studies which have done some protocols to improve the thyroid nodules. I have made specific videos for them. You can definitely check out those videos. I think that you will like them. It takes time for these nodules to get better, minimum of 6 months to 1 year of following certain things. Even then, we cannot guarantee that. So I have seen some people getting better with thyroid nodules, some people not. So that's a hit and miss. I'm still looking for that perfect protocol that will help with thyroid nodules, but right now, unfortunately, I have not. But in that protocol, what they use curcumin, they use boswellia, which are those two anti-inflammatory things, and they were using spirulina. Those are the three things that they used. Along with that, I generally like to add black cumin seed oil and also omega-3 supplementations to help reduce the thyroid nodules. So those are the things that you can add to it. So that's where our Inflammapro supplement is again great, because it has boswellia, it has curcumin, it has quercetin, all those anti-inflammatory things in one Inflammapro. And then you pair it down with your good quality omega-3s that we have. And a lot of times that does the trick of thyroid nodules. Again, I'm not claiming over here that thyroid nodules goes away in 100% of my patients. Not really. Hopefully one day I will have that protocol that they will go away in 100% of patients, but it's still in work in progress. But at least we have research studies that this protocol works in some people. So give it a try and see how you do with the thyroid nodules. Okay, great. I think we are coming to the end of our session, and again, I apologize that we could not get all the questions that you are posting over here. But as I said, we will be keep posting the form, so please fill up that form, so that way we can look at all your questions and then try to answer those that you are submitting in the form. And so make sure that your question get answered. Again, we try level best. And as I said, we'll keep trying these live sessions in the future also, so that way keep giving you new information, keep giving you guys hope to get better. And meanwhile, keep sharing your comments, in the comment section, in the videos that I am releasing, whether they are helping you or not, because that keeps me motivated. It is a lot of work to release these videos, because I try to research first and make sure I present the topics in a more research manner, not just kind of giving my opinions. So that way you guys know that the information I'm sharing with you is safe and also at least have some research backing. Unfortunately, still functional medicine and natural medicine lacks the research that I will like it to have. One day we will have more research, but every day everybody's contributing towards this functional medicine in a small way of doing more research studies. So yes, please kind of keep doing that. One question I want to ask about pregnancy and things. So a lot of people have asked us, or um, reaches back, like, can the supplements and what to do during the pregnancy. So during the pregnancy is a high risks, like state. During the pregnancy you cannot do much. You will have to take the thyroid medicine and some of the supplements we don't want you to take. But if you have Hashimoto's, your thyroid disorders, then a lot of females are reaching us back because it is difficult for them to become pregnant. It does affect their fertility issues, and it also affects, can they carry a pregnancy to full term or not. Now what happens is that Hashimoto's is an autoimmune condition. Most of the people, like most of the females, will have all the testing done, everything comes back normal, and what they're diagnosed with, and ultimately obviously they go for IVF treatment, very expensive treatment, and emotionally also very draining for people who are trying to, and couples who are trying to do that. The problem in these females is what we call as an undiagnosed autoimmune infertility. Basically, your body itself is kind of, rejecting the eggs or not letting your body to get pregnant. And most of these females, have underlying Hashimoto's. Their thyroid levels might be normal, like TSH, T3, T4, but their thyroid antibodies are high, and that autoimmune component doesn't let them be pregnant or affect their fertility issues. So yes, we have research studies. It's not me. You can go online and look for research studies which says that females who have Hashimoto's disease, that can definitely affect their fertility. I'm not saying that each and every Hashimoto's patients will have difficulty in getting pregnant, but yes, it increases the chances. So again, if you can work on your Hashimoto, especially in the autoimmune piece of it, not on the thyroid hormone levels, that anybody can fix, right? Giving you the levothyroxine or any thyroid medicine will get your TSH back to normal, but that will not get those females pregnant. We are talking about the autoimmune piece of it, those antibodies. If you work on those antibodies, then there is a good chance that you can become pregnant or sustain a good pregnancy. But that is a lot of work. Okay. So, yes, I just wanted to touch on that topic because we get a lot of questions about it. Because apparently, a lot of females are having difficulty in getting pregnant in these days. So, yes. So, can you do that? Alrighty. So yes. So thank you so much. We are running out of time. Actually, we have gone above the time that we wanted to dedicate towards the live session. Thank you so much again, guys, for joining over here. I really appreciate, sparing your time and coming to these live sessions or listening to what I have to say. Keep showing your love. Keep sharing the information. Keep reaching us out. We'll try level best to help as many people as we can. And again, yes, we will probably come back again for some live session again in a couple of weeks. So look out for that community section. That's where you'll be posting information about the live sessions. And see you next time. Till the time, take care, enjoy, have a great time. Don't lose hope. Keep the hope alive of your health and getting you better. And this is me, Dr. Anshul Gupta, signing off today from this live session. All right. Take care, guys. Thank you so much again joining me. We'll see you next time. Bye bye.